Welcome to Vavene. Fardin, thank you very much for joining my podcast. We start right away. Please introduce yourself. Who are you? What are you doing? Tell us more about you.
Hi everyone. Good morning, good evening, wherever you are, whichever part of the world you are. I am Fardin Quazi. I live here in Dallas, Texas, in United States of America. I have been in the industry on healthcare IT technology for last 19 plus years, more than 19 years. My area of specialization is digital transformation and business transformation of healthcare administrative solutions, but I delve into clinical and non-clinical aspects both of healthcare. We have part of my expertise. I have created multiple healthcare technology, healthcare automation, process excellence, process automation solutions as well over the last many years. We have implemented them across the globe for our clients, mostly in United States, and specifically in the government healthcare line of business, which is like the Medicare for the elderly citizens and Medicaid for the underprivileged class of people. That's how like my work impacts people across the globe through the healthcare services. Apart from my day job and my expertise, I am also the senior vice president of a startup which we started with few of my friends and my like-minded colleagues. It's called the New World Foundation, where we create a technology platform for researchers, for budding uh, people to come and contribute, collaborate on technology, research, innovations, patents, and whatnot. Basically, it's kind of a thought leadership platform where everyone can come and contribute and create a better society. So that's a little bit from me. Thank you so much, Marco.
Here comes question number one. What inspired your interest in exploring the ethical challenges of AI in healthcare?
Wonderful question. So I'll give you a background of what inspired me to write that specific paper. As I told earlier to the audience, my work and my experience, I have delved into AI, specifically AI. How does it impact automation? But while I was doing research as part of, I write a lot of research papers as well. So I was thinking of some new ideas. So I was thinking like this AI, it's kind of a new toy in healthcare, but as much as we think about it can revolutionize patient care, it comes with its own set of challenges. So when I was thinking about writing something, uh, specifically focusing on how rapidly AI is being adopted across healthcare, across industries, but specifically in healthcare. But there's always some concerns that are we really addressing the ethical concerns when we are thinking about implementing AI? We are doing it left, right, and center everywhere. I'll give you some couple of examples. So just to set the ball rolling, what was the thought process behind writing this specific subject was, about during the COVID pandemic, we had certain AI based tools which were created, basically to look at prioritizing treatment based on data that kind of unintentionally discriminated against minority groups. That made me think, like if AI is capable of such profound good things to happen in healthcare specifically, what happens when ethics don't keep up? So the consequences, they were really enormous. Like it's life changing. In healthcare we are talking not about like intangible things like losing your financial assets or something. It's about life and death situation. So it's life changing for patients. It's also a reputation damage for institution. I'll give you another example. We all know about the pulse oximeter. We used it to measure the oxygen level. Well, during the, again, I'll go back to COVID example because that's where the thought process came.
You mean this little thing which we plug on the finger?
Absolutely. Absolutely. We used to put on the fingers and measure like if this reading is above 90 and 95, the we were saying, okay, you have lesser chance, but if it falls below 60, 50, the concern was like, okay, probably you might have COVID as part of the diagnosis which was happening. So that basic device which we used to measure oxygen levels, it was found to give inaccurate reading for people of color. So this is not even a high-tech AI issue. It's an example of how bias creeps into new technology. So now imagine like we are using AI everywhere in healthcare. So how it's kind of getting amplified. And again, as I mentioned earlier, it's kind of a life and death situation. So that's why like that drew me in, and wanted to dig deeper into the questions, like how do we ensure that this incredible technology about AI uplifts everyone, not just targeting a few where the application is being developed, but how it can impact globally. So my work focuses on answering the questions, exploring how ethics, governance, and responsible AI can reshape the application of it in healthcare. So that's where I thought probably let me dive deeper into it and see what future, where algorithms they impact millions of people. Also, we are probably understanding like ensuring that the future is fair, transparent, and inclusive. So whatever the things I was reading was being fed on the news and the internet, it was not kind of reassuring. So I decided, okay, let me delve deeper. Let me study through different papers, if different articles, different research which has already been there, and kind of collate everything and write one paper of my own. So that's where the interest and the inspiration came from.
Oh, wow. Okay. That's very interesting. Can you explain this, what you mentioned with the, what's the name of it again? Oximeter?
The pulse
Pulse
oximeter.
oximeter, where you said for colored people, it gave a different value, right?
Absolutely. It gave
Right.
inaccurate values. It gave inaccurate values.
Okay. Why was it this? Why was it a technical issue or?
So that the reason was those AI based tools which was developed to read the measurements of the oxygen level in the patients. The data which was fed into that system, which connected the AI pulse oximeter to the AI based diagnostic systems, it was based on the data, basically because those tools were developed in basically in China, as well as were developed in some European and the US countries. So the demographic of the people, it was like those people from Chinese origin, the people from the Caucasian origin, the people from United States. The demographic data was skewed towards that. So when that same oximeter was taken to African continent, to Southern Asian continent, the Middle Eastern regions, to Eastern European regions, the data varied even for healthy individual. It was showing inconclusive, incomprehensive, and incongruable results, which was one of the things which was kind of interesting, because when you're thinking, okay, it's a standard tool connected to a AI based diagnostic system, it should read the same level of information in a healthy individual, like giving a range of 90 plus, 95 plus. But that was not happening when the same device, exact same device, was used with people of color.
The next question is, which area of AI application in healthcare do you think has the most potential to transform patient care?
Okay, so I think so. I covered quite a few of those areas when I was writing the research paper, and apart from that, I studied a few more when I was doing the research. I picked a few and put it in my research paper. And probably, if you allow me, instead of one, I will identify three major areas of AI applications, which I think so. One of them is predictive analytics, which is uh, basically it predicts specifically as the word says. The next one is about personalized medicine, and the third one I can think about is you can say diagnostic imaging. So those three are the three areas. Let me walk you through each one of them. I'll probably give you some examples which I cited in my research as well. So let's talk about predictive analytics. So as I mentioned about, it's imagine a healthcare system that just treat illness, not just treat illness but predict as well. So that's why AR comes to the picture. So that is exactly predictive analytics, that it enables AI models and analyzes like huge tons of patient data. It analyzes everything.
Any illness or specific illnesses?
Oh, any analyst. So it's based on the data which is being fed. So you're talking about like everything from vital statistics of healthcare, the patient health information, to medical history, to their lifestyle factors, to identify patterns where they are experiencing. The clinicians, the diagnostic clinicians, they might miss out. So it's like kind of having a crystal ball of healthcare in front of you when you are using predictive analytics. You can specifically look not only in the future of the health of that patient, you can analyze their history, their genetic history, their genomic, their family history of the disease and all. So help them identify and predict what future health ailments they might encounter. So I'll give you some examples. There are some hospitals like they are using AI powered predictive tools to flag patients specifically of high risk like sepsis. It's kind of a life threatening situation condition
Oh
when
yeah,
you
yeah,
have.
very sepsis is very, very dangerous.
Yep, it's something like typically ignored, but as part of the surgical procedure, sepsis is very, very important. So they used AI tools, specifically the predictive analytics application of AI, and they identified like subtle changes in vitals and lab results. So what these tools did was they alerted doctors, and before the conditions they kind of go out of control, they spiral out. The proactive approach they help save countless lives. It's kind of a, you can say, the penicillin aha moment of during the World War II. Like it saved lots of people, lots of those the soldiers who were injured and they were treated uh, for the infections were typically used to happen. So typically you can say this is the next aha penicillin aha moment of diagnosis or predictive diagnosis, you can say. Another example I can give you is like predictive analytics. Again, since my area of specialization is more towards healthcare, non-clinical and administrative area, I'll give you one example. It's the predicting the hospital readmissions. So probably if most of us we know or do not know, like hospital readmissions cost the United States healthcare system more than $40 billion annually. So what predictive model can do is they can analyze why a typically discharged patient might return back, maybe due to gaps in follow-up care or medicine or like preventive care, which is kind of lacking. Most of the time we ignore them completely. So if we have predictive analytics armed with this information about the patients, the providers, the physicians, they can intervene earlier, they can reduce readmissions and improve outcome. That way the system and the infrastructure can focus more on the area or the surgeries or the inpatient services rather than focusing on the outpatient services. Even like ICU admissions are being helped by predictive analytics. Some AI based systems, they monitor patients vitals continuously, they predict and the need for intensive care units for hours and even days before it's critical. That way they can make the number of beds available based on the predicting the let's say during the pandemic we had like faced across the globe, we had faced a dearth of ICU beds availability. That's where predictive analytics comes into the picture. So they not only optimize like resource allocation, but they also ensure like timely intervention which can be life saving and make a difference between uh, pardon me, life and death for the patient situation.
Fardin, sorry, could you please name one example, one specific example?
Of the predictive analytics tool.
Yeah, exactly. Where what illness can it predict, and how would it be? Just give a example.
One example which I think about is the IBM Watson. Uh, it it is being used. I was probably going to cover that as part of diagnostic imaging. So let me answer that question as well. Uh, so IBM Watson Health, it was a tool. Although they ran into some issues at a later point of time, but let me not touch that aspect. So IBM Watson tool, the Watson Health, it was used to identify breast cancer in the mammograms or lung cancer through CT scans. So what IBM Watson did was it was able to compare to the human analysis. It was able to predict those uh, diseases or probably oncoming or productiveness of the oncoming disease with greater accuracy than human radiologists who were doing it manually. So this is one example of a tool. They those just don't assist doctors.
Like checking the X-ray pictures, right?
Yep, exactly. Not just the X-rays, but we have those radiological images, the 3D mammograms, the CT scan outcomes, which give you the entire aura or the in. Not physician. I'm kind of lost for those words. Which we the reports which are generated. We have those colored 3D imaging system, the CT scans, the MRT scans, etc. So those are being read better by these AI enabled tools like IBM Watson. So IBM Watson, it's an example, not only a predictive analytics tool, but it's also the third aspect which I was talking initially about, the diagnostic imaging. So it's kind of turning the clinics into world class diagnosis centers. So it's kind of AI system. Another example of it, let me give you another example. It's the Google's DeepMind situation, application. Google, few years ago, I think so, it was 2017 or 2018. Google, they developed the DeepMind application which can diagnose eye diseases from retinal scans with almost near perfect accuracy. And it's kind of impressive how and transformative as well. Specifically, how it impacts is in rural, remote areas, underserved areas. I'm not talking about even the third world or the second world countries. Even within United States, we have a huge gap in the diagnosis of diseases, diagnosis of oncoming diseases as part of the predictive analytics, which I was talking about earlier, between the urban centers, let's say a hospital or the services which are available in cities like California or in New York area, compared to the Midwest, the rural, the deep the deep village areas where they don't have that kind of facilities, they don't have that kind of access. That's why AI comes into the picture. The local doctors, the local radiologists, they can just take the images, send it across on AI, and on real time, the AI tools, they can analyze and they can give you the specific outcomes. They can identify, okay, this particular image shows a potential for a bigger disease, it shows a potential for oncoming disease as well. So that's where diagnostic imaging comes into picture. They have some imaging tools also now capable of, as I was talking about, predicting the disease progression. That's one new term which I learned about when I was doing the research. For example, like let's say I go for my I'm more than 40 years old.
Really? You don't look like 30, 31, 32. That's what I said.
Maybe the AI is changing the appearance of my picture on the screen. That might be another application. I'll just give like example. I go for and as part of my annual preventive care, I get an X-ray, chest X-ray. Now, what the doctor will do is just look at the chest X-ray. It's the doctor is doing it right now as well. But when we start using more AI-based application, it will analyze the chest X-ray. It will depend, it will feed the family history. Let's say my grandparents, my great grandparents, if they have some situation when they were at my age, will they, will the disease develop into something major, some major heart related or cardiological related issues at a later point of time. That's why AI comes into the picture. It analyzes, saying, okay, the chest X-ray which you have taken, it not only gives you about your heart health heart I'm sorry health health heart situation, but it also gives you whether like other diseases, let's say pneumonia or any other bronchitis, if there is a potential in the next couple of years that this person might develop these small diseases, not only just the chronic diseases. And probably, and I'm not only talking about like the next few months or few years. AI is able to detect those the oncoming diseases in the next 48 hours as well. So that's how what we are talking about. Let me detect, since I was talking about these oncoming diseases and how probably AI can help personalize that, you can say, the outcome or the approach of treating that disease. The third point which I talked about was the personalized medicine. You can, just to put simple words, it's kind of a, we go to, instead of buying a suit from a shopping mall or from a shop, we go to a tailor and saying, hey, please create for me a custom suit for the upcoming event or something, or for my wedding. So that's where predictive personalized medicine comes into the picture. It gives you a customized, tailored approach. It analyzes your genetics, it's your environment, your lifestyles, the data, where you craft the treatment plan, which is specific and unique to the patient's DNA. I can probably just give kind of a real life examples. Nowadays, we all have Netflix subscription. We switch on the TV even before we can think about what movie to watch, what series to watch. Netflix gives you all the recommendation. So instead of us picking anything, we have we have everything in front of us. So that's where this personalized medicine comes into the picture. For a cancer patient, it doesn't just say randomly, okay, you have to go for radiology, you just have to do for chemotherapy. It can say, okay, for that particular cancer patient, based on their genetic history, this is the most effective medication, this is the most effective treatment approach to manage your cancer treatment. So another aspect of which I can think about is, it also studies the genetic makeup of the patient. They eliminate the trial and error approach. They often accompany the specific treatment, which spares the patient from not only unnecessary side effects. It's not kind of a hit and a miss situation of treatment plan, but it gives you the specific uh, as treatment, you can say a personalized treatment, uh, uh, you can say a workflow for your over the next course of few years, which increases the chance of successful outcomes as well. And I'll probably finish off this with one last thing, which is the application of pharmacogenomics. I didn't knew about this word. During my research I came to know, and it was really interesting. Yeah, it's, you can just make like three syllable words: pharmacogenomics. So we knew about genomics, it studies the genetic makeup, the DNA, our DNA history and everything. So what pharmacogenomics does it, uh, through AI based application, it identifies how a patient's genetic profile influence the response to certain medications. So I don't have to put a pill in my mouth and then see and wait for the reaction or the side effects. My genetic makeup and the information which is fed into the AI system, the pharmacogenomics, it will automatically identify this patient metabolism and reaction to that particular drug is safe, it's unsafe. It also predicts whether the results which will be derived from utilizing this medicine, it will be faster than others, it will be like a standard process, or it will be ineffective completely. So even before starting a medication procedure, starting a treatment plan, the pharmacogenomics can completely identify what will be the next course of not only the action from the physician, but next course of reaction from the patient as well, in terms of reacting to the medication which is being put, or with that patient is put upon. So those are the three areas to answer the initial question which you had asked. I'm sorry, I digressed a lot. We discussed a few things here and there. So we talked about the predictive analytics, we talked about diagnostic imaging, and we talked about the personalized medicine.
Yeah, that's very important to get examples, that we understand better what you're doing. And of course, what I can say so far already is data is king. The more data there is, the better the AI performs. What do you think healthcare providers should prioritize when integrating AI systems into their workflow?
This is one of the core crux of the entire research paper I was writing, like the prioritizing of when we integrate AI system. And that's my bread and butter of my day job as well. When we do the automation of the system, we do the process revamp and the you can say the process transformation, overall business transformation, and the digital transformation of our clients systems in healthcare sector. That's where integration comes into the picture. Typically we don't go nowadays, specifically don't go with a big bang approach. I had clients where we had like worked with them for worked on a specific legacy system for 35 years, but still we don't never go with a big bang approach. It creates a lot of repercussions, specifically in the workforce. They think the AI is here to replace their jobs, so we keep telling them it's there to assist you, not replace you. So answering the question, I think so. I covered that as part of the pardon me, four pillars, which I call them the BTPT framework.
BTPT framework
Yeah, BTPT. It stands for, it's something like I came up on my own when I was the research doing that research. So
will be a brand one day.
I I'm not sure about that, but maybe I'll give it a shot. uh, the BTPT, or the four pillars of the BTPT framework, stands for the bias, transparency, privacy, and training, which I think is the most focused and the prioritized area when we integrate AI system into the existing workflow, or probably any healthcare ecosystem. Let me talk about each one of them. One is the bias, one of the most important things. Probably, if I'm not sure, like if most of us know, most AI training data sets. I was talking about the people of color in my previous example, but we have the data sets which kind of the core data which feeds into the AI set of system before it can start working and giving us the results. They also underrepresent women and minority groups in any demographic when we pick up. It's true. Like even I was surprised when I was doing the research. An AI tool which is trained on data from like urban hospital, it struggles to make accurate predictions for rural populations. We talked about that earlier as well. This can lead to biased outcomes like misdiagnosis for underrepresented populations, mixed diagnosis even for women and minority groups and children as well. So what the providers should do when they are integrating AI system into their uh, overall healthcare workflows is they should prioritize diverse data set. They should ensure fairness. They should ensure like audits are done to prevent disparities. The data set should be revised. They should be analyzed regularly as through the audit process. They should basically, the providers, the physician, they should ask, does this specific algorithm they work equally well for all our patients, regarding of race, gender, or location? So that's where healthcare providers, they need to demand a diverse data set and fairness aware algorithm. The second of that BTPT framework is the T, which is transparency. Let me ask you a question. Let's say, imagine a doctor asking you, the AI is saying, hey, uh, Marco, you need a surgery. uh, so we will not say, hey, okay, let's go with, we don't say that, right? We'll probably asking, okay, but why do I need a surgery? So we are like, it's not a comforting statement from a physician who comes to us saying like, okay, these are the lab results, based on that you need a surgery because my AI tool is telling me you have to go for the surgery. Yeah. So that's like, that's where the transparency factor comes in. It's just not about like AI reading the results, it's also understand how the results were achieved. So the clinicians, the physicians who are using these AI tools, they need to say, see, here is where I flagged your X-ray. This is where the report lab results came and the reports. These are the specific areas where I marked, and through the utilization of AI tools. And this is not just an anomaly. It's something which I observed through your reports over the last few years. Just to give you another tangible example, it's like you put a destination in the GPS, and GPS say, hey, yeah, I'll take you. It doesn't tell you what the route is, what the direction, what street it will take you. It will just say, hey, just believe in me, I'll take you to your destination. We'll say, oh, hey, sorry, I'm not going to use that GPS. We need to see the route exactly, where, what are the turns, whether it's a toll road, it's not a toll road, where it's going to take us through a heavy traffic area, or probably it's going to skirt that, it probably take us through a highway or through the residential area. So that's where we need the path, apart, we need the destination, but we need the path as well. So that's where the transparency factor in AI comes into the picture. And where the provider should insist when they are identifying a specific AI tool, it's the explainable AI, or the XAI, which kind of lays out a clear reasoning for the recommendation when they are making one recommendation to the patient regarding the procedure they have to go for it. So that covers the transparency aspect in terms of explaining what typically the physicians or the provider should prioritize. The third part of the BTPT is the privacy, very important aspects.
Let me ask you one question. Transparency actually means also having trust in the AI, correct?
Oh, absolutely, absolutely, yep. So that's where the trust builds up, right? I'm sorry to interrupt you. Yeah, you can complete your question.
Yeah, no, no, everything fine. Just like it has to be a particularly AI which is already known, which builds up trust, where people trust in, right? So this is probably the key point in being transparent. I can even imagine that in the future, probably people maybe maybe trust less human doctors than certain AIs. It could be possible, right? Because based on experience, we put it in a good thing that AI really makes a very good job. Then, if someone goes to a doctor and the doctor says, "Yeah, I recommend you this surgery because we work with this AI and the AI said this," and the doctor explains it, it's possible that many people do not listen to the doctor anymore because they know the AI and they trust the AI. I mean, which is also good for the doctor because by using the AI, he basically inherits the trust. It's just he's not primarily the trustworthy anymore, right?
True, true. Let me hold on to that question. I have a very interesting point to address that specific question which you raised here. And just give me like 30 seconds. I'll just finish this BTPT framework and then explain you exactly what you are asking about, the trust aspect and the human centricity of AI. So coming back to the original question about the prioritizing when we integrate AI system into the workflows. The third part is the privacy, the data privacy. Basically, healthcare data breaches, if you are aware, in 2023 it exposed over 60 million patient records, or the PHI. So when we are talking about AI system, it should be bulletproof. It should, when it comes to privacy, it should also learn like have about federated learning about AI, where safeguards the data, even if the data is being circulated across, and having like higher access control. The responsibility of access lies in the hands of patients rather than like anyone who is using the data. The fourth aspect of the BTPT is the training framework, the training. So as you mentioned, you are trusting the patient, the AI more. One thing I always make, and whenever I talk to anyone, I had a few couple of conferences where I made this point, and I started making this statement was, AI is not here to replace human; it's there to augment the human capability. So that's the reason Microsoft, they named their Gen AI tool as Copilot. They didn't name it as Pilot because it's a Copilot. Pilot is still the human being. It's still the physicians, the doctors who are the pilot. The doctors, the nurses, and the administrative staffs, they are the pilots. So that's where training comes into the picture. Like the training, it enhances the capability of human beings, or the human experts, to diagnose, to analyze, to predict the health situations and the concerns about the patients. Coming back to the questions about the trust aspect, there is another kind of a buzzword which will be a huge thing 10 to 20 years down the line. It's called sentient AI. uh, Sentient, yeah, SENTIENT, sentient AI tool. And just to let the you and as well as the audience know, I am writing another research paper exactly on the subject, sentient AI, how to impact the decision making in healthcare. So probably in a couple of months that paper will be out. So what I study as part of sentient AI is the human centricity. So when you said you will trust AI more than the human physical human doctor or the human physician himself, uh,
Yeah, no, no, no. In the future,
in the
in the
future, yeah,
future.
exactly. So in the future, are we there yet? Are we not there yet? That's why sentient AI comes into the picture. Right now we don't have any specific tangible sentient AI tool. Sentient AI tool, what it is that it does it it comes, it adds the human touch. It makes the AI more tangible rather than AI kind of a, you can say, a tool based or a technology based intervention. It makes like AI. You can just get some glimpses of sentient AI in way. Let's say we pick up a phone and we have a IVR, or the automatic response system on the on specific webs, or for specific services which we dial. To an extent, we understand, okay, that IVR tool is responding to us. It's addressing the question, but at some point of time we kind of get frustrated, say, hey, then we say, can you connect me to a human operator? We end up doing that. The sentient AI aspects, it will come into the picture and say, okay, we don't need a specific physician. The sentient AI, it changes the direction, it changes the understanding of response based on the conversation it is having, based on the initial data which it is able to grasp, not only the historic data set which was fed into it, but even on the fly, on the real time data which is being fed into the sentient AI system, and it starts analyzing. So if the sentient AI it's able to get a new information about my disease, or some kind of ailment which I picked up just 24 hours before I walked into the clinic, the sentient AI should be able to quickly change the course of the guidance of the the diagnosis plan as well as the treatment plan for me, based on information which I just fed it, rather than relying on the historic data which was fed. That's where the trust kind of starts building up. That's where we'll start relying more. We still have people, patients, who do not give consent, saying, hey, sorry, I do not want AI intervention, I don't want AI based diagnosis for me, I want to have a face to face conversation with the doctor. In United States we still have like more than 50-60%, they do not insist on using telemedicine services or telehealth services, although it's available. I, being a technology person, we had that services from through my organization for the last 3 years. I started using it only about 1.5 years back, for small ailments. I would like rather just, and specifically I have small kids, so I'll just quickly get an appointment, run to the doctor, rather than relying on a telemedicine service where I can't even see the face of the doctor. But it's changing, it's changing, it's evolving. So the trust aspect, it's slowly and steadily, surely building up. So in future, we might have a situation where we don't have a human doctor available. We will have a sentient AI based, maybe an Android face or something, in front of us when we are doing the teleconsultation or for our health, and that we will be having enough trust and enough faith in that particular diagnosis and the particular conversation we might have regarding our health.
One particular question to your BTBT, I call it framework, the BTPT framework. It starts with being the biased. I mean, biased, the data set biased. Now, I'm not saying, okay, people who train the AI do this intentionally. Of course not. It just can happen that the data they use, because if they use labeled data or even unlabeled data, that without knowing the data set and basically the whole AI is biased, correct?
True, true. Yeah, exactly. That's one of the major issues which we have. Pardon me. Facing the current AI applications, the current AI tools, specifically where which are being used in the healthcare sector, and as I initially said, like for financial sector, for the investment sector, for manufacturing sector, a small error, it's okay. Like that can probably affect the output, affect the productivity. It might reduce my bank balance by a few $1,000s if AI goes wrong. In healthcare, it's about a matter of life and death. A small mistake during the surgical procedure can probably put the, like, just to cut off the life support system from for a patient, which is completely relying on specific AI based tools. So we cannot really take a chance. And I initially mentioned, most of these AI applications, they are developed in US and Europe. They are the first world countries. They have the infrastructure available to create those kind of tools. But when we go ahead and use those specific tools in African, the Asian, the Southeast Asian countries, the Pacific islands, where they don't have access to the technology, but we still have the hospitals, the networks going there and applying those AI based tools. Pardon me. But because the data was basically trained on the population where that tool was developed in US and the Europe, it doesn't really work well there. It ends up having that limitations. That's what we I'm sorry, we talk about the algorithm bias. So the algorithm bias happens, very simply put, it happens when the training data does not represent the diversity of the real world. So when I was doing the research, I found like examples where diagnostic tools, they failed women because they were trained on male centric data. The heart attack symptoms, if we are aware, in women are very different from men. And and typically vital signs are missed during the analysis when we are using AI based data, made typically on a specific demography, specific location, and specific data set which is fed into them. So bias in AI, healthcare AI specifically, it's not just a technological problem. It's about human problem. It can lead to unequal treatment, misdiagnosis, even life-threatening outcomes like underrepresenting groups. So the research emphasizes on need for rebalancing the data set. It creates to create a fairness aware machine learning technique. It should talk about pardon me, continuously auditing, which I also touched upon earlier, auditing to identify and address like these data biases do not, or the algorithmic biases rather, let me be more specific, do not come into the picture, and they address those specific issues. But we talked about the challenge, but the good news here is this can be resolved. And it can be resolved not only at the tool development or the AI application development level, because it's kind of a continuous learning kind of an application. It's like we create an AI based tool into a factory and just feed it or give it to the healthcare system or the hospital, saying, "Hey, just use it as it is." It's not like it keeps evolving because it's on the cloud, it's on the fly, it keeps learning. So we have the option to feed the data set. We have the options where the physicians or the providers, they can ask to rebalance the data sets to include diverse stakeholder inputs. And as I talked about, keep talking about the regular algorithm in audits that is specifically needed, like annual or probably even biannual audits are needed to assess whether what the outcome of the AI based on diagnosis, based on predictive analytics, it has worked well, or if it has not worked well. That's where we can utilize and rework on the algorithm and work and address the biases where we are failing, it's failing them. So that's it's kind of, it can be worked upon. and it's the outcome should be a reflection of our entire social inequalities rather than just addressing a specific population or addressing a specific area of algorithmic bias concern.
When we go back, what you mentioned about telemedicine,
Mhm,
that most people actually are not using it right now.
mhm,
It's on the way that more and more people are using it.
mhm,
Then we can basically imagine if we would have already AI tools for the market,
mhm,
which can be used by every practitioner,
mhm,
like every normal doctor. Then the question is, because the regular patient, it's not an expert in techniques, in informatics, nor in AI.
mhm.
Then my question is, how important is the explainability in AI models for patient trust?
So explainable AI, which I talked about earlier, it helps you get that black box aspect out of your uh, diagnosis or the treatment plan which is created for you. uh, it's like uh, uh, if I can think about a kind of, I'm thinking about a real life example of explainable AI. uh, the doctor is able to give you a specific guidance on uh, what goes into the diagnosis, what goes into the outcome of the specific treatment plan. It just doesn't give you, okay, this is what the AI was able to predict, and this is what AI is able to address the specific concern. It's able to analyze your lab results, it's able to give you the outcome, it's able to give you a treatment plan. The explainable AI, it does is it gives you the entire procedure step by step. It gives you the data points, what it analyzed, what was the reason it was able to give you that specific anomaly or create kind of raise a red flag into that specific city. As I mentioned about the initial one, like I go for a chest x-ray, the AI is able to identify pinpoint, like there might be some dots here and there. We think like probably it's just a smudge on my X-ray report, but the AI, because it's been fed with diverse and enormous data sets, the explainable AI aspect comes into the picture, and it gives you the pointers, specific pointers, saying this particular dot which you see on your X-ray report, it is because of this particular concern which is related to this particular genetic makeup which you had because of the specific family history. So it takes out that black box concept which I was initially mentioning about out of the picture. So I, as a patient, I'm assured, okay, the doctor is kind of not faking the, or kind of not just conning me, saying okay, because he wants to earn some extra high dollars of copay and force me into a force uh, way, a kind of a abuse of the system through fraudulent means. I can trust the doctor saying, hey, the reasons which you explain, it kind of I relate with that, those reasons. I can understand. Okay, yep, I had my great grandfather. I'm probably I'm not go that far. I had my grandfather who had a ailment when he was in his 40s at that point of time, and I am, because I'm passing those genes across through generations. I am probably might be in the same situation, but he was able to address it better because he was living in that particular time. Now the AI is saying, because I am eating more processed food, I'm using more plastic, I'm using more microwave energy when I'm preparing my food, and I'm using all those things which are kind of corrupting my food, if I can use that word. So you are at higher risk compared to your grandfather. So that's why AI comes into the picture, explains me everything. So I said, okay, yes, I agree to AI. I'm not like just blindly believing what the doctor or the physician is telling me. And that's how explainable AI, it really helps you take that mistrust out of the equation. It takes the ambiguity out of the situation, and it creates a clear, good, transparent process. And probably it provides a platform for the patient consent as well. And when that happens, what I'll do is like saying, I'll be able to tell the doctor and the provider set up, saying okay, because I trust the system, I allow you to use my data, probably a mask data or something, to be utilized for future diagnosis for other patients similar to my demographic. Let's say like I belong to a South Asian demography. So probably if some other person from the same demography comes, and because the AI was trained on my data set, I said, okay, go ahead and use that on the other patient if it helps save another life. That's how probably the explainable AI concept comes into the picture.
I mean, what we also should mention on the, on the sideway is like, on the side is, not all
Mhm.
doctors have the best in mind for their patients, because some of them are also driven by money,
True, true. No,
right?
that's
We have to be honest,
yep, yep, yep.
it's a human thing. Some of them, they are driven by
Mhm.
money, and I believe personally, in this particular
Mhm.
case, AI can actually help the patient,
Mhm.
because AI will suggest something different than this particular doctor would,
Oh,
right?
absolutely, absolutely. Yep, yep. I agree.
Yeah, we also have to see the positive
Hmm.
sides of
And
it.
it also helps us, like as you that I keep going back to the sentence which you mentioned, and probably it's a very important point you made. Like we don't blindly follow AI right now. We might not do that in future as well. End of the day, even some people, like specifically the senior citizens, they still need that human centric. My parents, they live in India. They have the telemedicine services available, but they say, hey, see, we are retired, we don't have much things to do around. Rather, I'll go visit a doctor, talk to the doctor about generic things. And while during that, I will also talk about my health ailments. So that's human touch. The human centricity comes into the picture. As I mentioned earlier, the sentient AI, which is going to come out in the market in the next 10 years or so, or might even earlier, might add that element as well. Like talk to my parents much conveniently and much better about things, about the weather, about the news, about the politics, apart from the healthcare as well. Not just train on specific healthcare data set, but it can use its brain, if I you can use that terminology, to come up with a conversation which will be interesting to that specific demographic population.
In your BTPT framework, the last T stands for training. And of course, we know AI is only as powerful as its data set. And to be very powerful in the future, it needs new data. So, as I think in a technical perspective, every time an AI is used, the data it's generated should be reused to train on it. That would be like the perfect or the optimal way to enhance the AI. Just this comes also with a concern, and the concern is, what is the single most effective way to address privacy concerns in AI-driven healthcare?
When we talk about privacy concerns impacting AI driven healthcare, uh, what I think so, if I recall correctly, I talked about federated learning. It's a new concept about federated learning. If I can put it in simple words, it's kind of a secret sauce which AI uses, does not learn.
Yeah, that's very simple. A secret sauce. That was a that was a good joke, Fardin. Yeah, I keep this in mind. Yeah, if I can put it in simple words, it's a secret sauce.
It's a secret sauce. So whenever we talk about someone talks to you about federated learning of AI, you can understand, okay, it's a secret sauce with these big large organizations that are using nowadays, specifically for making these Gen AI based tools. Again, just let me put that word. We still do not have a standard generative AI model. All these chat GPTs and co-pilots, they are still going there, but still at not at that level of generative AI. I'm sorry, well, not digress to the question which you asked me. Addressing the privacy concerns in AI driven healthcare, we talk about the cutting edge technologies or the secret sauce called the federated learning. So I'll explain you how it works. So what it does is, instead of sending like patient data to a central server, that's what we used to do. Like few years back, I go to a hospital system, they take a note of all my vitals, all my historic medical history and everything, and they feed it into this local system which was there in the hospital hospital system or the central server of the hospital for training their AI. A couple of years back, when AI was still in a nascent stage and still developing, what federated learning it does, it allows the algorithm to learn directly from decentralized data sets. So the data, it's never leaves the hospital. It's a privacy first by design. So that's where how we address the privacy concern of AI driven healthcare. So I'll give you an example. Again, example is I keep giving examples. I like to like explain it in a more simplistic and understanding way. We go back to the COVID-19 pandemic, where we had the global healthcare system. They were training their AI models to detect the viruses when they were sharing the information. And at that point of time, no one was even talking about data privacy. The information was being shared across the countries, across the globes. So we had lots of data breaches of patients' information happened as well. But at that point of time, our focus was on treatment, saving lives, and all. But we in future we we have to ensure, even when such a huge or the healthcare catastrophe occurs, we cannot really ignore about the data privacy, specifically in healthcare when we are talking about patient health information, the patient's health data privacy. So what it does is, without sharing a single patient record, the federated learning, when it comes into action, it's kind of creates a privacy environment even while the data is being shared. So what it does is, let me give you a better example here. Like, I'll probably move away from the technology part. Is we have these, when we take a picture using our digital cameras, right? We have all these blurs and everything which is around, like probably it creates a light or around our body or system. So we click on the AI based tool and says, please, hey, denoise my picture, denoise my video which I had taken, so that I, as I and front in the picture, I and the center person in the picture, my image becomes really clear. In federated learning, we do exactly the opposite. We take the patient's health record, but when we are using it for research and diagnosis and training the AI, we noise the data set. It's the reverse process. What we do is, we take all the information which is not private to the patient, we highlight that information, but the central information about patient, let's say my specific medical condition, we blur that information. We do not match it. Let's say I'll again give an example. Let's say I have a heart condition. So when that data information is being sent for research and diagnosis and for training the data, it will not say Fardin Quazi has a heart condition and my date of birth is this, I belong to this city. It will blur some of the information so that the mapping does happen. But when the data is being transcribed through an encrypted data set fed into the AI algorithm, it cannot relate or correlate between my name, my date of birth, my demography, to my heart condition, to my ailment, to my medical history. But it's still feeding the information saying one particular person who lives in this particular part of United States, who belongs to a South Asian origin or demography, has this kind of ailment developed over the last few years. That's how let's train the data sets. So that's called noising of the data sets. That's one of the very key aspects which federated learning does to address the privacy concern. So that we are not only just missing out on feeding the data set, developing a robust algorithm to remove the bias, but we are also ensuring that the patient's information is safeguarded. The patient information is not shared across the platform, and and it's being utilized ethically. I come back to the title of my paper. The information is being utilized ethically and responsibility. I'll give you one more thing, which earlier this year I presented a paper on blockchain. So blockchain I utilize. There is a thing about ownership of the data sharing lying in the hands of the patient rather than the provider. So when I started this response, I talked about when a couple of years back we had our physical information stored in the hospital system, hospital network. We are still doing that, but that information is right now, and we when we utilize blockchain, that information is there encrypted. Even if the hospital are using my information, they cannot do it without my consent, even if it's stored in their system. So they have to approach me, I have to give a token, I have to enable access to that particular information to be utilized, so that the power lies into my hands. As such, what I'm doing is I'm getting that privacy responsibility back into the patient's hand, whose data is being utilized. So it kind of, this federated learning aspects, the blockchain aspect, it really addresses the future concerns about patients, the privacy concerns about AI and federated learning. I hope I answered your question.
Yeah, yeah. Thank you, thank you. Yeah, because you know the concerns in privacy is basically if it's not the main point what the criticism is always pointing out. It's like that, yeah, we have a privacy concern by using AI or by training AI. So it was very important to ask you this question that we can better understand, okay, how could we deal with this situation? And yes, I see it your way. It's probably some people make things bigger than they really are. In your opinion, what is the most overlooked ethical consideration in AI development for healthcare?
Overlooked ethical consideration. See what we talked about data privacy. The general aspects we touched about them, the data privacy, the bias, the accountability as well. One of the fundamental aspect which often gets overlooked is I touched upon that at the last one when I was talking about blockchain. It's the informed consent, the rights of the patient to understand and to actively participate participate in decision making process which involves their care, especially when AI is involved. It probably also touches upon the aspect of initial thing which you talked about, building the trust. So when we talked about informed consent, so sorry, why does informed consent matter in AI when we are talking about healthcare? Informed consent is not just a formality, like okay, we have to ask the patient just for the sake of it. No, it's kind of involving the patients in decision making, making them informed, making them educated. It's kind of creating a patient autonomy and trust. So the patients, they have when I go to a doctor, I have a right to know how my data is being used, what role AI is playing in the diagnosis or treatment of my particular disease onset, my particular treatment plan. I also need to know what are the risks, the limitations, what are the alternatives to our AI driven decisions. We talked about black boxes earlier, we talked about explainable AI. All those things are part of the informed consent. So what AI typically right now it's being doing is like it's kind of complicating the process a little bit. So most of the tools which are right now in the market, they are doing is even the clinicians, the physicians who are using those tools, they typically do not understand how the tools are being used. They just put the data, feed the data into it, it generates the outcome, and they kind of, if I should use the word, some of the physicians, they just vomit out the information in front of the patient saying, hey, okay, you go ahead and analyze what I just mentioned to you. So we are talking about explainable AI. So the AI should be able to give assist the physicians to give a clear information so that they are able to explain it to the patient. So that's where informed consent comes into the picture. Like without clear communication about what AI is doing, why it is doing, the informed consent then becomes like little bit of superficial. It's kind of doing a checkbox saying, okay, we have used AI and inform the outcome to the patient. No, that's not being told. So it's like AI is using to diagnose the condition, but it's not giving the details. So the what the challenges currently and what are being overlooked currently, it's like uh, when we are communicating the AI based results to the patient, you need to explain to the patient that AI system is able to, what's the complexity involved, what are the things, what are the tools, what are the nitty gritties or the technology. I'll not probably use the word technology, but what goes into the process of AI addressing, analyzing your data set, analyzing the information which is being fed, and how probably the information is being used not only to address your concern, but only not only but also to make the AI more robust, so that in future when you come back to the hospital, because with your consent we were able to address the specific concerns or the anomalies you had, the AI is able to utilize that through your informed consent and able to address. So patients, they realize, okay, this I was talking about the noising of the data set, like the reverse of denoising. So it's kind of doing anonymizing the data set, if I can use that word, to train the AI system. So the patient's consent is very, very important when we are talking about this one aspects of where we are kind of typically off late, it's being overlooked and it's not being addressed properly, apart from typically the general ones, the privacy, the bias, the accountability, etc., etc.
Fardin, I still have a question open. And one of those questions, because I have two questions open, is what challenges have you encountered in advocating for governance frameworks in AI systems?
Okay, I was hoping you'll not ask that question to me, but when we talk about governance in AI, we typically touch upon the the regulation, the compliance, and the restrictions, which typically not only the users of AI, but the implementers of AI, and probably the, you can say, the big brother watching over you, how you are using AI, and specifically when it comes to healthcare, that's why the challenge is. We just can't go blindly utilize AI because specifically United States, it's a lawsuit heavy country. Any small things you can just sue the system, you can sue the government, you can sue anyone, and then the case goes on into millions of dollars. So governments, they have to do that, and that's where governance comes into the picture. So when we are advocating for governance framework, uh, and specifically when we are talking about AI, it's evolving, it's continuously evolving. Again, let me give you another tangible example. I'm sorry, my kids also keep complaining, why do you digress from the topic and give us so many examples? I said I like doing that. I like to simplify things. Governance, it's like keeping a check and balance, and at the same time it's not stopping what you're doing already, because AI is evolving over the last 3 years. Even the least technology person has known that AI has touched upon their aspects in some way or the other. So when you are doing a governance, you are creating, evolving the compliance, the regulation model. You cannot stop the AI, audit, assess, and then say, okay, now this is our checkpoint, this is the report, now let's move on. It's like, you might have seen one of those videos of Middle East. People are driving the car and they are changing the tires and the wheels of the car while they're driving and kind of tilting on one side. You can say governance is typically to that kind of a situation. So like you are replacing a flat tire of a car without stopping it, you are still driving it. So exactly, that's where the governance comes into the picture, and we have to do that. So because AI is evolving, as I mentioned, it's evolving so fast, the regulation and framework, they have to constantly play a catch up game. And some of the challenges which you specifically asked, in advocating for governance framework in AI, I can think about is, like, we have the fragmented regulations right now. We have regulations, but they are fragmented. And when we are talking about AI application, the AI tools being used, developed in one country and being applied in other country, we cannot have like a HIPAA or a CDS AI based guidelines regulating United States. uh, then we cannot have a GDPR, the General Data Protection Rights, in European countries. We cannot have a DPDP in Asian countries. We have to have like what is permissible in one country, not applicable in other country. That does not work for AI. We are talking about a global application. We are talking about global rules. So right now, what we have, these standardizations, the compliance, the regulance as part of the overall governance mechanism, they're all fragmented right now. That's one of the major challenges. The second one is, which is very very important, it's about the resistance to change. You take automation, a simple thing like you take automation to a person who has been working on a specific thing for the last 20, 30, 40 years, they will obviously, they will resist to change. Even a simple thing like I introduce a new food to my toddler, they just shrug initially saying, no, I don't want to try this. So it's typical, it's a typical human behavior saying, like, you come up with some new tools and application, they are averse to change, they don't want to change what they have been doing for years. So that's what we have to do when we are talking about governance. The healthcare organization, they need to be risk averse. When you're implementing a governance framework, it requires a cultural as well as an operational shift. That's a major thing which needs to be addressed. And many institutions, they are hesitant, they are averse, they're saying we don't want to disrupt our existing workflow. So that's called, and it's also called like something we call the fear of unknown. If you don't know what's going to happen, and then these organizations, some of the smaller organizations who know they should adopt AI as part of their overall governance and implementation process, they says, will it slow us down, will we be able to use it, how are we going to address it concern, we have been doing everything well for the last so many years. Other thing which they think about it, is it going to be too expensive, they start doing the ROI analysis as well. So that's something, the averseness, the change management aspect comes into the picture, which is which should be part of the governance framework whenever we are implementing a new AI based application. The third thing which I can think about is the resource constraint. We are still in a dearth of these prompt engineers, the AI based specialists, the AI SMEs. And when we talk about governance, in creating a governance framework, very honestly, it's not cheap. They require investment in technology, they require investment in training from scratch to people who have been industry veterans for 30, 35 years. Building a developing an expertise. Imagine like a doctor who has been very used to, like, he's a 50 plus years of experience, used to like writing prescriptions on a paper slip and giving across. You suddenly in 90s, early 90s, you introduce computers to them. They think, hey, what are you doing? I have been doing my duty for the last so many years. So this is what's happening in the current situation. The doctors who are used to the regular automations or the regular governance mechanism utilizing tools and technology, they kind of say, hey, I don't want to use this particular AI application. So that's where like the expertise, the training aspect comes into the picture, and training should be baked into the governance framework. We just cannot go buy a off the shelf AI application and get into my healthcare ecosystem saying, okay, from tomorrow onwards all the administrative staff should start using this for doing the hospital admission management or through enrollment procedure. No, you have to train them, you have to educate them, you have to have a training, uh, kind of a training framework set up and design to and built into the governance framework for future changes as well. As I initially mentioned, AI is continuously evolving. So it's not like I take a training today and that training will be utilized or applicable for the next 6 months. No, I have to take a training, I have to keep upgrading myself every couple of months. So it's kind of what the governance framework does it. When there is a lack of resources and there is a there is a there is no so I probably put it simply, when there is a lack of resources, the governance framework, it creates some kind of an oversight mechanism, and it addresses the gaps between what we have and we do not have compared to the market situation. So it's kind of an enabler. I'll give you an example again. I'm sorry, going back to example. An example which I used in my research paper about the Duke University health system. If you probably recall that, it went through a three-pronged framework about training, the human utilization, and the change management aspect as well. So what Duke University health system they did was they created a comprehensive AI governance framework. They included ethical review board, they had continuous audit created. So that framework, they didn't just ensure compliance, it also improved the quality and trustworthiness of the AI tool. Coming back to that point which you made about building a trust, that's an outcome of having a robust governance mechanism. So when we are talking about like the challenges, they are typically real, but the rewards of getting the governance right, they are even much more exponential, and much more outcome is much more greater than the investment, the initial the question where it's too expensive. It's kind of a putting the money where it's going to reap rich rewards and outcomes for you. So it also ensure like the AI tool, it doesn't just work, and it works ethically, it works responsibly, and it works equitably as well.
So far, we are at the end of our episode. Thank you so much for participating. And I would love to give the last words to you.
Sure, sure. Let me be ethical and responsible. Let me not talk about my personal stuff here. Although I have lots of things, I have a book in plan as well, with not specifically touching upon AI aspect, but AI will be part of that book about the BPAS automation solutions. So AI surely will be part of that. I'll also touch about the aspects of AI, ethical and responsible AI. Another book chapter I am contributing, it's about ethical AI co-pilots. So we talk specifically about one particular AI application and how ethics and different we have lots of tools which are coming up in to address specific ethical concerns. So we are exploring those. We are going to address that in our book as well. And yeah, like my probably if the audience are going to follow me, I have a website created, fardinquazi.com. If you just follow that, I keep updating my research papers and everything. In the next couple of months, you might see that sentient AI and how it's going to impact the decision making in healthcare come out. That would be an interesting read. Probably I can boast a little bit about it. That was a new concept which I was really enjoyed while I was writing that paper. My parting words will be like probably some thought process about when we are talking about AI ethics within healthcare. So what I'll tell the researchers, the people who are uh, putting their hands into the AI set of things is, do not forget the ethical and the responsibility aspect of AI. I know that it, as I mentioned at the right at the beginning, it's a new toy in the market, but you have to use it ethically. You have to use it responsibility, because in healthcare it's about a situation, it's about life and death situation of the people who are going to be impacted by it, who are going to be touched upon that. It's very different from having a AI in a bank system, having a AI in a manufacturing sector, having a AI in an energy sector, even in the government sector. But here we are talking about human lives. So, like the researchers, the future people, the future generations, when they are talking about AI, not only the coming months and years, but like 10, 20 years down the line, they should be like curious, but they should stay grounded as well. They have to address the ethical concern as much as the technological advancement. We have also to think about interdisciplinary. Right now I'm just talking about healthcare all the time, but in future when AI develops, it's going to collaborate across industry, across domains. Few years ago we were just talking about automation at a clinical level. Now when we talk about automation and healthcare, we are talking about clinical, we are talking about ethicists, we are talking about policymakers, we're talking about patient consent, we are talking about involving patients. So that's how the new AI based design or AI based tools should be designed, taking the diverse users as well as the people who are going to be impacted by it, to get involved in it, and probably addressing each and every demographic consent. We talked about algorithm bias, we talked about the patient privacy, we talked about transparency. So all those aspects come into the picture whenever you are thinking about future design tools. The last thing which I will tell is, we have to stay updated. As I said, like it's AI uh, kind of catching up, the governance mechanism. With that was a very interesting question which you asked. We are doing a catch up game all the time. It's like changing the tire of the car while you're driving it. So for that you have to stay updated all the time. AI, it's a fast moving tool. If probably most of us we are aware, like just last year White House, they released the guidance on ethical AI. They released a specific paper on ethical AI, through the federal government regulation aspect, and they prioritize like AI should be the focus of the federal government in the coming years. And it's not just about like White House releasing a report or the application in United States. We are also talking about the global organization. They are constantly updating the standards, so we need to keep updated what are these development. Because let's say as part of a large organization who are utilizing AI in day-to-day tools, I cannot just pick up a tool, take it to a different country, different region, different continent, and just utilize and implement that tool and say, okay, this is going to work everywhere. No, we have to understand like all these organizations, they are uh, coming up with regulations at their country, their region specific level as well. So that collaboration, the cultural alignment should be there as well. So those are the things which I want to say as part of my parting words, and probably I look forward to have and read more interesting articles, research outcomes, as well as study about new tools, specifically touching and addressing the aspects of ethical and responsible AI as well.